Today, I want to talk to you about how you can improve your sleep. Sleep is one of the most important factors for having a sharper brain, both in the short term and in the long term. A lot of cleansing, a lot of cleaning, a lot of rejuvenation happens during deep sleep. So if you deprive yourself of deep sleep, you not only have difficulty focusing the following day, but your brain will not be happier and healthier 20, 30 years later. Now, everybody knows that sleep is good and everybody knows that they need to sleep 7 to 8 hours, but some people can't. I believe the most important step in improving your sleep is to believe that your sleeping can be improved. In my years of experience in dealing with patients, I've come to appreciate that many people think sleep problems are common, everybody has them, I have them, so it is what it is. No. If you can't sleep well, you need to make that a priority and fix it, because as I just mentioned, it has both short-term and long-term benefits and harms if you don't do it right. Now, if you have difficulty falling asleep or staying asleep, you need to follow common sense sleep hygiene recommendations. Things like don't drink caffeinated beverages in the afternoon, don't watch horror movies before going to bed, read a book or do something relaxing before going to bed. Keep your bedroom quiet and dark. Do not bring exercise equipment or a desk to work in your bedroom. Your bedroom should be just for 3 things: sleep, reading, and sex. Nothing else. Of course, if you have a lot of anxiety, you need to have a strategy on how to deal with those. If you keep worrying about financial issues and you wake up in the morning or in the middle of the night, you need to have a plan of how you will deal with that. It's not that you can solve them immediately. You need to have a plan for how they will be solved in the next 2 years, 5 years, or 10 years. If you have a plan of action, your mind can relax and it can settle the things that keep you up at night so you can sleep through the night. Now, if you still can't sleep, you need to make sure you don't have medical issues. Sometimes low iron levels can cause difficulty sleeping. Anemia, thyroid issues, vitamin deficiencies can cause sleep problems. If you have had sleep problems for many years and you've tried different things and nothing has worked, you need to talk to your doctor and undergo routine blood tests to make sure you don't have those medical conditions I just mentioned. If you've done those things and you cannot sleep more than 3 or 4 hours a night, here's what I recommend. You need to follow what's called cognitive behavior therapy for insomnia. It's also referred to as sleep restriction treatment. The idea is that if you restrict the amount of time you're in bed and you only sleep 3 hours, then during those 3 hours, you will sleep because your body is exhausted and needs all the sleep it can get. And then you increase that interval gradually and you reset your mind and your brain so you can sleep 7 or 8 hours regularly. So to start this program, you set up a time that you will wake up every day, exactly the same time, regardless of how much you slept the night before. Let's say 7 a.m. Then you only go to bed at 4 a.m. so that you have 3 hours in bed. You'll be exhausted by 4 a.m. and then you will fall asleep from 4 to 7, especially the second night or third night, where you only have had 3 hours a night. Your body is craving to go to bed, and so during the 3 hours, you will be sleeping. You will not be tossing and turning. You'll be exhausted and deep sleep. After the first 3 nights, then you sleep 4 hours a night. You sleep from 3 a.m. to 7 a.m. Again, you walk around, you read, you do everything not to fall asleep before 3 a.m. And then at 3 a.m., when you hit the pillow, you will sleep for the full 4 hours. And then after 3 nights, you sleep for 4 hours and 5 hours. And every 3 nights, you increase the number of hours you sleep by 1 hour until you sleep 7 to 8 hours. This strategy, this gradual increasing number of hours that you're in bed and you're allowed to sleep, resets your brain and you get used to sleeping 7 to 8 hours a night. This program does work and I strongly recommend it that you try. Good luck.